I'd like to introduce myself. I'm a patient of Dr. Robertson's, and I had 4 months ago full facelift, and my eyes were lifted, the upper and lower. So I'm amazed that in just 4 months of my recovery, I've done very well. I am 65 and will turn 66 this year. So I had plenty of wrinkles through all those years, and still 65 is not too late. Certainly glad I didn't wait any longer. So how I came to visit Dr. Robertson was not a direct route, because I've never thought I would consider plastic surgery. I am terrified of needles, and the prospect of someone being cut open was just not a possibility for me to ever consider. But I think it really started when my eye doctor at an annual exam said, you know, eventually you're going to have your eyelids lifted, because it's going to impact your sight. And that planted a seed, and then maybe a year later I started seeing photographs of myself, and I saw that my eyes looked so squinty. I didn't like it. So I then had, months and months, if not years, went by, and I was in an appointment with my dermatologist, who I adore and been to for many years. And as we were wrapping up an annual visit, I said, I'm contemplating getting an eye lift. Can you recommend someone? And he immediately said, Dr. Robertson. So I made an appointment right away, and within a week I had an appointment to see him. And so he sat down, and I told him that I was interested in eye lift, and he spent an hour and a half with me, and he introduced very gently the idea of, once I'm being cut open, why don't I consider a little more? And so I did. I took my time, and actually after that appointment, certainly I recognized immediately that I had complete trust and faith in Dr. Robertson as a surgeon, and my surgeon possibly. But I thought that day, well, if I were to have this done, I would wait till a February. And this was in October. And by that coming February, I was scheduled for the surgery. So there are a number of things that built my confidence. First of all, my dermatologist is within this clinic, Dr. Martin's. So I've always had a positive experience with him. And so to have a recommendation of a surgeon given to me by him, that said a lot. But he had really persuasive things to tell me about Dr. Robertson. And the staff here were so quick to set up the appointment for me, and gave me confidence in saying, here's your point person. This will be your representative through the whole process. If you have any questions, start here. And so that felt comfortable. And I really just felt all my needs would be met. If I had a question, it would be answered. But when I came for my first appointment with Dr. Robertson, first of all, there was no charge for this consultation. There was no commitment on my part at that point. And I thought I would talk to him for half an hour. And he gave me all the time I needed. Turned out I was here an hour and a half. And his bedside manner is excellent. And so I felt so comfortable with him, person. I learned about his background and his experience and how he came to be in private practice. Tremendous experience at Johns Hopkins, and then as a director at University of Maryland's shock trauma. And so he's had all kinds of experience with people in desperate situations for plastic surgery, not just someone like me looking for an aesthetic improvement. And but he took me as seriously as he would take anyone in any situation. So to think how this has changed my life, actually I can remember now in a follow-up appointment, just a matter of, if not just 10 days after my surgery, I said to Dr. Robertson, you transform people. How does this feel? I think you have this amazing capacity to make such a difference in a human's life. Of course, he's very modest and understated. He is not a plastic surgeon you're going to find on Dr. Oz or Oprah, which is another thing that's important to me. The fact, or even on TV, he's so understated and modest about his accomplishments. And he really wouldn't take that compliment. I would think that would make his work so rewarding, and I'm sure it does, but he won't take all that credit. But for me, since I went into this expecting just to have an eye lift to kind of brighten my eyes, and I didn't have great expectations about that because my eye socket is a limitation. It's not huge, and so I thought that my eyes would look a little brighter, but it's way beyond my expectation how they look. And to tell you the truth is, when I was young, my father used to tease me, and he would say to me, "Does your face hurt?" And I would, be puzzled and confused and, shake my head. I don't know what you're talking about. No, my face doesn't hurt. But I really felt my face hurt by the time I was 65. And it took energy to lift my face to express gratitude or welcomeness, or how I wanted to present myself to another person, to receive them in a welcoming way. And it really felt like it took energy to lift my face. So I often thought about my father's tease me about, does my face hurt? Yeah, I would say then that my face did hurt. So since I was going into this only expecting to have my eyes look a little brighter, and I came out on the other side with smoother skin and really a prettier profile, way beyond what I expected, I've been overwhelmed. And I just feel like my days are brighter because I look at myself and I'm brighter. So I saw Dr. Robertson 10 days before my surgery for just going through the checklist of preparing, and it's a regular appointment that everyone's set up with. Actually, wasn't with him, it was with an assistant here and a nurse, just to go over the checklist. And as I was wrapping up that conversation, I had some questions that only he could answer, and right now I can't remember what they were. It might have been some more questions about where the cuts would be, or just some details. And his nurse said, "Would you like to meet with him again before the surgery?" This is 10 days before the surgery. And I hadn't thought about it, needing to, and she said, "Would you like to?" And I said, "Yes." So I came in for another hour appointment. It's clear the staff here wants to be sure that any reservation or any questions you have are addressed. Way beyond what I even felt I had a right to request. And so had that meeting with him, which answered anything else question I had. The stitches were out, I think within 2 weeks. And one discomfort I didn't expect was 2 days after my surgery, the drainage tubes were removed, and that was a little uncomfortable, but they do it as quickly as they can. Washed my hair, which was a blessing. And we actually took a picture that day of me and Dr. Robertson standing together. And it wasn't for another 5 days before you start to see the yellowing from the bruising, which all of us have been bruised before, and so that's a cycle that you expect to see. In some ways you think it's looking worse when it's really getting better, but I was prepared for that. And then after the stitches were removed, that could be removed, the ones that dissolved took another 2 weeks, and that just happens naturally in the shower as you're shampooing yourself. So those aren't noticeable to the public. They're in your hairline and no one can see them. So that you're presentable to the public very quickly. I mean, most people, I think, that need to go back to work are back at work in 3 weeks. I took 4 weeks because I have a very public job, and I felt my boss would prefer that I wait 4 weeks. But as I said, I was walking Main Street, within a week of having the surgery without any qualms, as long as I had sunglasses on and a scarf and cap. So it all went much faster than I expected. But now the phenomena of watching your face change as it settles in, I don't know, you're beyond the point of there be any bruising or any of the stitches. I mean, you're healed, but your face is still calming down, I should say. And that's really, to me, that was just intriguing to see that change. I never felt impatient about it because I had no pain. That's the amazing thing. I really had no discomfort after surgery. And you think about having to sleep sitting up would be uncomfortable. It's not, because that's what you want to do. I thought I was going to be as eager to be able to get back to exercising and not worry about holding my head up and those things. But it all comes to you naturally. When you're ready to do more, you feel like doing more, and it's safe for you to do more. One little piece I hadn't thought about was when I could put my contact lenses in, and that took less than 3 weeks. And it's just the swelling in your eye has to go down so your lens will fit. I think it went faster than even Dr. Robertson expected. So there are lots of little pieces that you experience, but they're not alarming, and you'll have tremendous patience for them because the benefits are so huge.